You woke up fine. Nothing happened. No bad news, no near miss, no reason at all. But your heart is doing something strange. Too fast or too hard or just slightly off. And your brain immediately locks on. Is this anxiety? Is this something worse? Is this the thing that finally gets you? That question is happening to millions of people right now. And most of them have no idea that the answer is far stranger than either option they're afraid of. Here is what nobody tells you. Anxiety and several serious medical conditions feel identical from the inside. Not similar. Identical. The racing heart, the chest tightness, the hyper-awareness of your own breathing. All of it can come from your nervous system, your thyroid, your heart, or your blood sugar. Your body doesn't label the source. It just sends the signal. So how do you actually know which one you're dealing with? Most people assume anxiety is the "nothing is wrong" diagnosis. The doctor runs the tests, finds nothing, and says, "Must be anxiety." That framing is dangerous, because anxiety isn't what's left over after medicine rules everything out. Anxiety is its own physiological event, with its own hormonal cascade and its own measurable effects on your cardiovascular system. But here is the complication. Your nervous system is an extraordinarily unreliable narrator. Dr. David Barlow, one of the world's leading anxiety researchers, documented what he called the anxiety sensitivity spiral. You notice a physical sensation. Your brain flags it as dangerous. Fear triggers your sympathetic nervous system, which produces more of the sensation. More sensation feeds more fear. You are now in a loop. And the original trigger barely matters anymore. By the time you're deep in the spiral, the original signal is completely buried under your own reaction to it. Several medical conditions can light the fuse that starts that loop, and if the underlying condition is never treated, no amount of breathing exercises will fully resolve what you're experiencing. The first one is your thyroid. When it produces too much hormone, a condition called hyperthyroidism, the result is a near-perfect simulation of a panic disorder. Racing heart, trembling hands, racing thoughts, constant low-level dread. People spend years in anxiety treatment when the actual problem is a blood test away. A study published in the journal Psychosomatics found thyroid dysfunction in a significant portion of patients previously diagnosed with generalized anxiety disorder. The symptoms had been treated, the cause had not. The second condition is POTS, postural orthostatic tachycardia syndrome. When you stand up, your heart rate spikes dramatically. You feel dizzy, your chest gets tight. Your brain interprets all of it as danger. Many people with POTS spend years being told they have panic attacks. They do have panic attacks. But those attacks are triggered by a malfunction in their autonomic nervous system. Dr. Blair Grubb, who has studied POTS extensively, describes it as one of the most commonly misdiagnosed conditions in young adults, particularly women. The third is arrhythmia. Your heart has an electrical system. Sometimes it misfires. The sensation of a heart doing something unexpected is one of the most reliable panic triggers that exists. Your brain does not distinguish between a benign palpitation and a dangerous one. It has one alarm, and it pulls it every time. Now, what about true late-onset anxiety? Is that even real? It is, and it is more common than most people realize. Research from Harvard Medical School's psychiatry department has documented significant new-onset anxiety in adults over 40, over 50, even over 60, with no prior history. What triggers it? Almost always a combination of factors arriving simultaneously. A major life transition, a health scare, sustained stress that depletes your nervous system's capacity to regulate itself, hormonal shifts, especially in perimenopause and menopause, lower the threshold at which your brain perceives threat. Sleep disruption amplifies everything. Here is something that surprises most people. Your brain physically changes under sustained stress. The amygdala, the part that processes threat, actually enlarges. The prefrontal cortex, which normally puts the brakes on emotional reactivity, becomes relatively quieter. Your threat detection gets louder. Your regulation gets weaker. This is why anxiety arriving in your 40s or 50s feels different from stress you handled easily before. You are not weaker. Your brain has been structurally shifted by accumulated load. Dr. Sonia Lupien, director of the Center for Studies on Human Stress, has documented for decades how sustained cortisol exposure reshapes neural architecture. Late-onset anxiety is not a personality failure. It is a measurable physiological outcome of sustained overload. So what do you actually do? You cannot reliably distinguish anxiety from a medical cause on your own. This is not a failure of intelligence. It is a structural limitation of your nervous system. The signals feel identical because they travel the same pathways. Start with a doctor who will run the full panel. A complete thyroid test, not just TSH, but T3 and T4. A metabolic panel checking blood sugar and electrolytes. An EKG for a baseline of your heart's electrical activity. If you experience dizziness tied to standing, ask about POTS. If episodes arrive with no psychological trigger whatsoever, ask for a Holter monitor. A device worn for 24 to 48 hours that records every heartbeat. Once medical causes have been investigated and either treated or ruled out, you have a cleaner picture. And if what remains is anxiety, real effective interventions exist. Cognitive behavioral therapy is the most evidence-supported treatment available. Not because it teaches positive thinking. CBT works because it systematically interrupts the attention threat loop. It teaches your nervous system, through practice, not insight, to evaluate sensations differently. The spiral can be interrupted. Somatic approaches that work directly with the body have also shown strong results, particularly for anxiety that is highly physical in nature. Techniques that regulate the vagus nerve and reset the autonomic nervous system are documented, measurable, and increasingly supported by neurobiology. Medication is a tool, not a surrender. For some people, an SSRI provides the neurological floor of stability that allows everything else to work. That is a conversation to have with a physician, not a decision to make based on what your anxiety tells you about medication. And here is what matters most about late-onset anxiety specifically. The fact that it arrived later in your life tells you something important. Your nervous system has been working for a long time. Something, stress, hormones, sleep, accumulated loss, has finally exceeded its capacity to silently compensate. That is not weakness, that is a signal. And signals, by definition, point somewhere. You woke up fine today. Nothing happened. And then something in your chest reminded you that your body is always working, always monitoring, always trying to tell you something. The question is not whether to be afraid of that signal. The question is whether you are finally ready to listen to what it is actually saying. That, it turns out, is what separates the people who spend a decade in the spiral from the people who find their way out of it. Not courage, not willpower. Just the willingness to ask the right question and then take the next step to answer it.